Everyone from the Connecting Kids to Coverage campaign, and we are thrilled to have so many of you join us today for our webinar on messages that motivate enrollment in Medicaid and CHIP. To get us started, I'm going to pass this over to Donna Cohen-Ross with CMS to welcome and introduce our webinar today.
Great. Thank you so much, Sandy, and let me add my thanks to everyone for joining us this afternoon. We're very excited to be kicking off the webinars that will really be the meat of our campaign, all of the important information about strategy, materials, everything we need to really run an effective campaign. So we're very glad for all of you who have joined us today. As Sandy said, our topic is about messaging. We'll talk about the importance of messaging, what goes into an effective message. We'll talk about some specific messages that we're going to be using and promoting based on research. And of course, messaging and the messengers are fundamental to our effective outreach and enrollment efforts. We're also very, very excited to be showcasing the debut of our new materials that will soon be available to all grantees and partners across the country. So before we close up shop today, we'll be showing you what those materials look like, and you'll be hearing more about where you can find them and what will be available to you. So without taking any more time, I'm going to turn it back to Sandy. I think she's going to give us some logistics.
Thanks, Donna. So I just wanted to run through a couple of technical details as we get started here. Because we have so many of you on the phone today, we will be keeping your lines muted throughout the webinar. We will have 2 chances for question and answers, though. So we are going to go through our messaging presentation and provide an open Q&A. When we have this question and answer portion, you can ask questions throughout the webinar through your chat feature by typing in the question box in your control panel on the right-hand side of your screen. These questions you can ask while the presentation is going on, and we will collect them and try to address as many of them as possible. There is also a feature that allows you to raise your hand. It is the little hand icon in the control panel. You can use this to indicate you have a question as well, and we will do our best to call on you during the Q&A session. Please be aware that if you are logged onto the audio through your computer, you will need microphone capabilities in order to ask a question. So with those housekeeping issues out of the way, I'm going to introduce Allison Betty from GMMB, who's going to get into our messaging presentation.
Great, thanks, Sandy. Hi, everybody. Good to at least talk with you again. I wish I could see your faces. But we are really pleased to take this time at the beginning of the year to just talk about messaging, kind of where we are on Medicaid and CHIP enrollment, and the best ways to motivate people to take that step, pick up the phone, get online, whatever it may be, walk into an office, and get their kids and hopefully themselves enrolled too. So just a little bit of 101 here so that you're clear that what we're offering here today isn't meant to be too prescriptive, but just to remind you of some of the core thematics that we see. Look, the good news is that this research has not changed dramatically in the past 10 years that I've been doing it, and more for many of you. There are some kind of nuances here and there that we're going to walk through today, but likely this will all feel pretty familiar. We just wanted to do a little bit of a refresher. So what is messaging, right? It's what you want to say. It's certainly not what they want to hear. Often when we go through reviewing research like this, we'll see a survey that says, you know, certain % of people believe blank. Well, that doesn't necessarily mean that we want to tell them what they believe. We want to be able to explain to them either why they might be misinterpreting it or what they can do to change their situation. So we want to meet them where they are. We know that a lot of our audience is very skeptical, very busy, and juggling a lot of things. So we try to find ways to get these messages to them, kind of as many touch points as possible. And of course, this is about persuasion. I won't call it selling. It's not a popularity contest. So sometimes we find that messages that might be the more uncomfortable ones are, in fact, the ones that work the best in testing. So what really makes it clear and simple, make it short as possible, I implore you to make it as short as possible when you are sitting there writing it. We all are in that place where we get stuck because there's so many details that we might need to share about a program, or lots of different types of audiences that need different information. The simpler and the shorter the better. Keep it personal and relevant to their lives. Use very plain language. We talk a lot about making sure that we're reaching audiences with low literacy levels, but frankly, that really stands for everyone, just making it as simple and as direct as possible. Keeping it persuasive, that means timely and relevant to the issues that are going on in their lives. Use themes and words that resonate. We certainly know a lot of that from research to date. And be credible. We want to be able to use proof points that just prove the basic facts of why Medicaid and CHIP, why they might be eligible for Medicaid and CHIP. So let's talk a little bit about perceptions of both programs. They are both very well recognized and very valued among parents. They're frankly valued among everybody. The last bit of research we did on this was for the Robert Wood Johnson Foundation just a few months ago. I think many of you have seen some of that, and it really did bring home that point that Medicaid and CHIP are valued. People want health insurance. They don't need to be told that it's great. They just need to be told that they can get it and that there's an option for them. So parents are willing to enroll their kids. They're eager to do so. And those that are on the program are satisfied with the care that their child does receive. Now, I get a lot of questions about stigma a lot, and are there stigma with either of these programs? And I would say across the board, absolutely not. What there is skepticism. What there are experiences where people may have had problems with an application process in the past, or and not necessarily, by the way, with the actual care or the service of CHIP and Medicaid, but just getting in. And they can find it difficult to enroll, but that has been made easier over time with the condensed applications, and some have been moved online, and just overall, they've been more simplified. And we're really pleased to see that. But that skepticism does exist, and there are clear barriers. Parents may not think that their children are eligible. That can be for a couple of reasons. They may think it's that they make too much money, particularly on CHIP. They may think the enrollment process is just too difficult. We see that a lot still with the applications that are combined of Medicaid and CHIP, because there might be some different requirements. And parents often don't know where to go online to enroll or where to get an application. So they may have had an experience years ago where they had been given a paper application. But now going online, they might not know exactly where to find that. And as we all know, some of those websites can be a lot of information in one place. The top motivators for parents overall has always been peace of mind. And that is just the basic premise of insurance, right? That it just comes from knowing that your child is covered no matter what happens, that your child will get the care that they need, and getting that coverage, of course, at a price they can afford. Talking about the benefits is always really brings it home, so understanding what the benefits and the services actually are, and knowing that their child is likely to be eligible, that it's possible. So let's talk a little bit about how we try to cut through some of that skepticism and put it together in some messages that we found to be really testing the best. This peace of mind idea. Busy parents do have their hands full, as we all know, and they can use an extra hand. Medicaid and CHIP offer low-cost or free health insurance for kids and teens up to age 19, and now there's one less thing to worry about. So you'll see this kind of language across a lot of our materials. It's not meant, again, to convince them that insurance is a good thing. They know that all too well, but it's meant to relate to them, to a concept and an idea that they are familiar with, that yes, the parents are busy, and boy, wouldn't it be nice if there was one less thing to worry about. Affordability. We have said for many years, and it continues to test the best, I promise you, we've seen this really head and shoulders above the others. We don't talk about affordable coverage. We talk about Medicaid and CHIP offering low-cost or free health insurance for kids and teens. And for those of you who have heard me say this before, I apologize for being redundant, but low-cost and free really do need to go together. Affordability, of course, is relative to everybody. So when we say low-cost and free, we avoid the issue of talking about just free, which number one, often isn't true, and number two, people perceive things that are free of not having real value. The flip side of that is that if we just say low cost, they may say, well, you know, that's low cost, but probably not low enough cost for me. We put them together, and low cost starts to look a lot lower. Of course, we always want to list the services. Medicaid and CHIP cover key services, including immunizations, doctor and dental visits, hospital care, mental health services, prescriptions, and more. Over time, we have seen a lot of resonance around dental coverage. So we try to include that where possible. And this list is essentially in the list of priority in terms of how well it tested across different services. Income eligibility. I know this one sometimes is tough because suggesting an income for one person is going to be different than a family of four. Generally, we've seen great success with using a family of four earning up to a certain amount a year or more can still qualify. We don't mean to be coy with that. What we're trying to do is get accurate, but at the same time, give them a number so they think that it's actually possible that they might be able, that their kids might be eligible. Over the past year, we've seen some great new research around Hispanic and Latino families and their reaction to messages, as well as parents of teens. And those are two really high priority audiences for us on this campaign this year. So generally, the motivators are largely the same, but there are a couple of different nuances here. The outreach effort should acknowledge parents' role as caregivers. We don't always have to talk to them as parents. We can talk to them as parents and caregivers. We want to emphasize how health coverage is important to a child's success. Just trying to draw that broader picture of a healthy child is one that succeeds in school and succeeds in life. Community partners are key here. We always want to be looking for partnerships where we've got trusted sources of information, and particularly in smaller, very tight-knit, cross-cultural communities, that can be valuable. And address those perceived barriers. So let's talk about that. I know this is tricky because people are often worried about kind of leading with their chin on this information, but I encourage you to be as direct about some of the citizenship barriers that these audiences may perceive. And perception is not quite reality here, but do offer reassurance. When you apply for Medicaid and CHIP for your child, only the child's citizenship or immigration status is considered. And as directly as you can say that, all the better. We saw a great deal of trust amongst these audiences in Medicaid and CHIP programs. In fact, often when we asked what they would do, they would say they would walk right into a Medicaid office. So there is a great deal of trust there when the language is very direct. Of course, we want to address language barriers and remind them that somebody on the other end of the phone will be speaking Spanish, and encourage them to enroll again. This is, I think, important for those who have had experiences enrolling and have not been successful. If you can say that the law has changed, go ahead and do it. Again, it might feel like leading with your chin because you just fixed a problem. The flip side is these people are so familiar with the program and so familiar with the experience of enrollment that they do need to know that detail. That the application process is easy, and of course that you can get assistance from a Spanish-speaking representative. So these are just some examples of how to more directly address some of those barriers. Moving on to teens. So as we all know, we see the numbers spike more, the uninsured numbers spike more with teens. And you know, we generally think that's for a couple of reasons. One is that these teens are often out of a regular immunization schedule or vaccination schedule. And they're strong and they're active, and they may not really need to be seeing a doctor as often as the little ones. And therefore, their parents may be less anxious about a teen's health than one of a younger child. And they may be getting some care at school, or they may be getting some of this through sports. So while they really do value insurance, the urgency may be a little bit different. And they may not be thinking that their teen is eligible because they might be familiar with programs, you know, like Head Start and WIC that are for the real little guys. So generally, we've seen that these messages across the board work very well. All of these messages work very well with parents of teens. All you really have to say is kids and teens if you're worried about those audiences. But we really didn't see a whole lot that jumped out that was entirely different from the basic messaging that we've seen with the rest of parents who might have smaller children. So do refer to children and teens, and we've spelled it out there. And do remind them that teens need health insurance, that school-age children and teens need checkups, immunizations to attend school and play sports. We did see a little bit of an uptick in the messaging when we talked about the kinds of activities that teens might be partaking in. So again, these are just examples. We've seen some folks in states talk more specifically about other issues that affect teens. like family planning and confidentiality, and seen some success there as well. So that is a really quick run-through of the highlights of the messaging. And I think what we'd like to do is move on to Q&A. I'll pass it back over to Sandy.
Yeah, and just as a reminder to everyone on the technical details of asking a question, there is a question box in the control panel to the right of your screen, and you can type questions into that, or we also have a raise your hand feature. It's the little hand icon in your control panel, and you can use this to indicate if you have a question, and we will do our best to call on you. So just let us know if you would like to ask a question. We have gotten a couple questions in as we've been chatting. So one of the questions was messages aimed at retention and enrollment. And I'm going to ask Allison to answer that.
Yeah, I think what we've seen in research is that the retention and enrollment issue has a lot more to do, frankly, with the tactics of getting people to re-up than it does with the actual messaging. We're seeing really very little difference there than the messaging that we've just gone through here, which is essentially reminding them of the services that are available to them, not necessarily reminding them of the coverage, but telling them, you know, what they can get and where they can get it. Particularly important for those who have been enrolled in the program, but frankly haven't used the services. So I know we've talked with states over time about how you can begin to target some of those lists and understand who are high users and not, because generally the ones that are using the services less are the ones that might not re-up.
Great. Thanks, Allison. And a number of you have been asking just as whether or not this presentation will be available online, and the answer is yes, it will. There will be a recording of this webinar as well as the PowerPoint presentation available probably in the next couple weeks on insurekidsnow.gov. So you can get access to all of these messages after our webinar today.
You know, Sandy, I see a question here that we got about whether or not there are negative perceptions of agency staff. You know, we really haven't seen that. Sometimes I'm fascinated when talking with Medicaid staff about the stigma that the staff perceives is there, that often we don't really see in the public opinion research. So we haven't really seen that. We hear every now and then about the complexity of an application process, whether it is that it's multiple steps or that it takes some time to figure out how to fill out the application and the assistance, but we really haven't seen a negative perception of any staff or personnel.
Great. Another question that came through is just about messages for tribal audiences. We know this is a very key constituency for many of you. The messages for these groups tend to, of course, be the same motivators that work for all parents, as we've just gone through, but there are particular cultural sensitivities around working within the elders and the multi-generational communities that are so important to our tribal and American Indian groups. And I also wanted to ask Donna to comment a little bit on some of the eligibility, misconceptions about eligibility that may come up in your tribal audiences.
Thanks, Sandy. I guess the one point that I would add to what Sandy has said, and I know there are probably a lot of our tribal grantees, our outreach grantees on the phone that maybe have even more to say about this. Very often, families may think that if they are getting services through tribal health clinics and such, that either they might not be eligible for Medicaid or CHIP, or that it isn't necessary. And I know that some of our tribal grantees have done a great job of promoting the message that enrollment in Medicaid and CHIP helps those tribal clinics and other tribal health facilities continue to operate at a very high level and be able to offer the services that the community needs because they are getting reimbursement through the health insurance programs, and that helps to sustain them and stabilize them. And so this concept of enrolling your child also helps your community is something that I think people have found to be very successful, and it's something to really keep in mind.
What's come through is how do we figure out who to target in our outreach efforts and the messaging that goes with that?
Yeah, 'tis the season for that, huh, with so many changes happening. You know, I think there's some really great data out there now in terms of uninsurance rates by age and by income that allow for that. Census, of course, does a lot of that. SHADE Act does, and they're at the University of Minnesota. And then I think coupled with what we're seeing with some of the public opinion data, there really is a way to start to narrow down, I guess the best way I'll say it is the types of profiles of people that are likely uninsured and would like to enroll. So I would encourage kind of an overlay of digging through the research, the county-by-county research that Census has and that others have, and then taking a look at the ample public opinion research so that you can begin to match up a little bit, not only where to find these people, but what they need to hear. And the good news is that what they need to hear is pretty consistent.
Allison, this is Donna. May I just add one point to that?
Yes, please.
Great. I wasn't sure if I was on. I guess I would say two quick things. One is less a targeting issue, but just to let everyone on the phone know that we have a tool on insurekidsnow.gov, which is basically a map, and if you click on your state, it will tell you what the Medicaid and CHIP participation rate is in your state. Nationally, we are doing really, really well. We're up to almost 86% participation, which means the percentage of eligible children who are enrolled. And we have many states that are at or even above that national average. That's what makes it an average. But you could also see where your state falls and give you a sense of where you are in that pecking order, so to speak. For some states, we may be able to get the participation data at a more localized level. That's if you're in a really big state. It's sometimes easier to do that than a small state. So I wanted to bring people's attention to that. But the other way that some of our outreach partners have been targeting some of their efforts is to look at some of the local data that we have. For example, many of our partners have been able to get from their Department of Education a list of schools around the country, around their state or local area, a list of schools that have high percentages of children who are eligible for free or reduced price school lunches. That's sometimes a proxy for where we might want to go to target our outreach and enrollment efforts, because we know that we have a greater chance of getting the population who might be eligible for Medicaid and CHIP, because the income guidelines are very similar to the free and reduced price meal program. So those kinds of strategies are kind of, I would, again, call them sort of proxy measures for where we might find the eligible but unenrolled. And I would urge folks to think through what there might be, what other ways of finding those measures would be, and we can talk more about that. Thank you.
Great. Thank you so much, Donna. Another question that's come through, which has been interesting, is the social media aspect. Is it a good way to share information with teens? Some of you have been using Twitter to share information on events and enrollment locations and that kind of basic information.
Yeah, this is a constant conversation and a tricky one, and frankly, I think it's ever shifting. I think 2 years ago we would have said it's really not the place, and I think now we would say it's sometimes the place, because social media really just is a part of all of the marketing and outreach that we're doing. I think what's probably important to remember about it is that social media is a place where people gather to have the conversation they want to have, and it is not a very successful way to push information into a conversation. So it needs to be relevant to teens in a way that would make sense for them. So, and in the kinds of places that they might be talking about, maybe training for a sport at their school, or some activity that would, where getting health insurance would be a necessary part of that. So that's specific for teens. With parents, I think it's the same thing, that some of those conversations can happen among social media areas that are talking about parenting, that might be kids with chronic conditions, places where it would be really relevant to their life at the moment. I don't think it has proven yet to be a very successful medium for otherwise healthy people that don't have an immediate need for coverage. But again, that's going to change over time. So if you're thinking a little bit about how you perhaps are budgeting or where you're allocating your staff time and resources, I would say not to neglect it, but that it's probably not a primary area to encourage actual enrollment right now. Great for awareness when you can do it. We haven't quite seen the data yet to prove that on enrollment.
Allison, this is Donna again, and I wanted to just share with folks that I completely agree with what you've said, particularly that we don't know as much as we hope that we will soon know about exactly how we best use social media. But one of the things that CMS is doing through a partnership with Text for Baby, which is a program that many of you may be familiar with, it's a text messaging program that provides health information to pregnant women and new moms about all kinds of things related to pregnancy and care of children during the first year of life. And I think this goes to Allison's point about it's good to communicate with people through social media on topics that they've kind of opted into and they've already said they're interested in. The thing that we have just launched is a whole raft of messaging about Medicaid and CHIP and how to enroll. We just launched it with Text for Baby right before Christmas time, and in the next couple of months we'll be getting some data about Text for Baby users and whether the messaging that we have that we hope is going to drive them to insure kids now to sign up for health coverage for themselves or their children is actually working. And as we get that information and learn more about how to do this well, we will be sharing it with everyone. And so we're grateful for that opportunity and that partnership as well.
Great. Thanks, Donna. There's another question here about how best to work with your county or local agencies.
That is a great question. So I guess there's a couple different ways to address this. One is starting it for the first time, which I fundamentally believe nobody is doing for the first time. But how to really improve relationships with either local governments or county governments. I mean, there's just been so much success from a nonprofit perspective, and often what's the collaboration kind of between local and state agencies kind of might get left behind. And the only example that I think I can really pull up in the front of my brain would be with county governments. I mean, look, everybody's stretched, but with county governments, being able to really engage them with the nonprofit and lead organizations that are doing great work in their area and allowing them to have a little bit more ownership of it, I think has been helpful. We've certainly seen that those folks could get kind of left out on a state program that's got community outreach, and the county gets left behind. And this varies so much state to state because the role that the counties play in enrollment varies so much. But if there are ways for them to have a very substantive role in the outreach where they are also getting recognized and promoted as part of the effort, that can help. We would be happy to question or talk with you more about that. There are some great toolkits and some things out there that might be helpful, and we would be really happy to work with you on that project.
Great. And just to tag on to Allison's point, we will be sharing information at the end of our webinar today on how to contact us. So if you have questions that were not answered, we will do our best to get you an answer. And you are always welcome to give us a call and email us, and we'll share that information a little bit later in the presentation.
Right. And this is Donna. I would just say on that point about connecting with local governments, whether they're county or municipal governments, we are very interested in helping to make those connections. We are working with National League of Cities, so we'd like to think about those channels. We also have connections with counties around the country who have been involved in the Connecting Kids to Coverage campaign. If you look on insurekidsnow.gov and you look at our outreach library, you'll see where some of those connections have been made, and perhaps they'll spark some ideas and interests. I'm thinking particularly of Alameda County, California, where the county has invested heavily in outreach and enrollment with the goal of getting every eligible child in their county enrolled. So there are some precedents for this, and sometimes policy tools that we can use, like presumptive eligibility, helps bring in county departments of public health and other kinds of agencies to help with the enrollment efforts. So check out that outreach video library, and if you have ideas or they spark ideas in you, please get in touch with our team, and we'd like to follow up with you and see what we can do to help make those connections.
Great, thanks, Donna.
And we see a raised hand from Tony Not Afraid. So we're going to unmute your line, and you are free to ask your question. Tony Not Afraid?
Okay, let's keep moving on.
Yeah, we have one question here that we thought was interesting about strategies in educating providers, federal qualified health centers, independent providers, about outreaching to this population.
Yes, good question, Eddie. I do think that, we hear time and time again that people hear about health insurance from kind of two people and two people alone. One is insurers, which doesn't help if they're uninsured, and second is their provider, their doctor or their nurse. So I agree that is a really critical, it's a really critical audience. We can help you with some trainings. We've seen some states do some really, and I think there are probably other people on this phone who could weigh in, of doing some great trainings, not only at clinics and federally qualified health centers, but also at hospitals, as well as other physicians or other providers that are serving this audience, to not only help them with the ins and outs of the program, but also to really understand kind of how it works and what kind of messages they need to hear. I do think that I would agree that it is really one of the most valuable audiences to be involved, and with so much changing in healthcare right now, this is a really great time to get providers engaged on Medicaid and CHIP specifically. So there are some toolkits along those lines, but we would be happy to help you with that too, and we'll get in touch.
We see one more hand raised. It's Thaddeus Dorch. Thaddeus, can you hear us? And if so, please ask your question.
Thaddeus may not have a microphone on the computer. And if that's the case, we'll ask that you could type in your question, and maybe we ought to move on to materials.
Yes, we will.
Okay.
Great questions, everyone. Thanks so much for submitting them. And we will have another Q&A period at the end of the presentation, so please feel free to continue asking your questions in the chat box. We do want to get on to our new materials. As Donna had mentioned, we're very excited to unveil some new materials created for the Connecting Kids to Coverage campaign. And as you will see, we have designed these materials around the peace of mind message we know works so well with parents. So as Allison had said earlier, busy parents have a lot of things to think about. They've got their hands full, whether it be their daredevil teen, mischievous school children, or a toddler that gets into everything. And health coverage is one less thing that they can worry about. The copy includes many of the points we just went over, and I know it's probably hard to read this on these slides, but it's basically Medicaid and CHIP offer low-cost or free health insurance for kids and teens. Children can get regular checkups, immunizations, doctor and dentist visits, hospital care, mental health services, prescriptions, and more. and it includes the eligibility income. A lot of these general purpose materials will be available to you. There are several photo options that we have available. You'll see the skateboarder, our muddy kids, and if we go to the next slide, our little artist here. All of these will be available in Spanish and English as well. They're going to be available in 2 sizes. We have a poster that will be 11 by 17 and a postcard that will be 4 by 9. So you have the option of tailoring this through CMS Design Services. We can tailor certain elements of the copy, which would be your state's Medicaid and CHIP program, the phone number and website that you need people to contact, your state's eligibility income, and up to 2 logos for your organization or your state CHIP, Medicaid and CHIP program. CMS will provide you with electronic files that you can then reproduce in a way that works best for you. And all of these materials will be available on the insurekidsnow.gov website. We hope to get them up there in the next several weeks, and they will be, as I said, available for you to customize for your state programs and your outreach and enrollment activities. These are general purpose materials that we wanted to have out in the field and help you with the great work that you're doing for outreach and enrollment. So in terms of our Connecting Kids to Coverage campaign, we also wanted to give you an update on some of the activities that we're working on. The campaign is in full gear, and to introduce our efforts here, I'm going to hand this over to Christine Gluns. She is our field director for the campaign, and she's got some great updates to share.
Thanks, Sandy, and good afternoon, everyone. As Sandy mentioned, my name is Christine Gluns, and I'm the field director for the Connecting Kids to Coverage campaign. I'm happy to provide the campaign update because we have a lot of interesting and innovative activities taking place in the field in different parts of the country during this winter wave. On behalf of the field team, I just want to let everyone know how excited we are to be well underway in this effort. We have at least 6 events planned in 6 target markets in the coming weeks. First, I should mention, though, that we have some special guests on the webinar today from our target markets, and they are going to speak to what they have planned for their winter wave events. So from Atlanta, we have Deamphis Williams, who is the Metro. Hi, Deamphis. He is the Metro manager from the Right from the Start Medicaid Outreach Project. And we also have Frederica Roper, who is the Senior Outreach Coordinator from West End Medical Centers out of Atlanta. And from Cincinnati, we have Trey Daly, the Senior Attorney at the Legal Aid Society of Greater Cincinnati. And right now I'm going to turn this over to Deamphis, who's going to start. Deamphis, I know you're there. Go ahead.
Good afternoon, everyone. Just to introduce you to the Right from the Start Outreach Project. We basically are an outreach project. We were started 20 years ago, so this is our anniversary year because of Georgia's high infant mortality rate. Since then, we've went into a number of programs. We work with the Peach Care for Kids, which is part of the CHIP program, the Women's Health Medicaid, which is for breast and cervical cancer, Planning for Healthy Babies to help families plan their children. Also, and then Family Medicaid, which includes pregnant women, children. So we do all of that. We do outreaches throughout the community. A lot of our outreaches are in churches, are in schools, health centers, libraries, any organization that we can partner with, that we can work with, basically to get it out to the public, to let them know what we do. So that's basically a quick, down and dirty overview of Right from the Start Medicaid. Frederica?
Great, thanks, Deamphis. Frederica, go ahead.
Hi, I'm Frederica Roper with West End Medical Centers, and we are an FQHC. So whoever had the FQHC question, please afterwards, when all the emails go out with the information, give me a call. West End Medical Center is a 2-year Cycle 2 grantee with the CHIP program and Peach Care and Medicaid. We've been in business for about 35 years, and we have about 6 sites here in Atlanta and throughout Metro Atlanta. And And through all this excitement and our partnerships with Right from the Start, because we've been working in partnership with Right from the Start for quite a while now, just kind of trickled down that the campaign was coming to Atlanta. So we've been at the table with Right from the Start and the Department of Community Health here in Atlanta, and we are planning a family fun Valentine's event at the College Park City Auditorium in College Park, and the venue is in a kind of ideal spot because it's located in front of a assisted housing complex where it's a target market for peach, carrot, chip. So on that day, we're going to provide some free health screenings, and we've branded our program as the Peach Reach program. So we're going to have our mascot out that day, which is Peach Bear for Peach Care, and we're going to do some arts and crafts with the children, and we're going to provide incentives for parents to just come through and obtain the information. And we have like some people that have enrolled with us in the Cycle 1 cycle that we're following up with to make sure that they've done their renewal. So we're also going to use it not only as a first-time enrollment event, but we're also going to try to target some of these people for retention as well. So that's basically what we're going to be doing on February 16th at the College Park City Auditorium.
Thank you so much, Frederica and Dianthus. I'm now going to turn it over to Trey. It is out of Cincinnati.
Hi. Hello, everybody. The Legal Aid Society of Greater Cincinnati is also a CHIPPR Cycle 1 and 2 grantee. The focus area of our Cycle 2 grant is school-based outreach, but we also emphasize outreach to Latino families. We provide outreach, enrollment, and retention services in 7 counties in southwestern Ohio that range from urban to suburban to Appalachian rural counties. There's a growing Latino population in the Hamilton and Butler County area which surrounds Cincinnati. We researched and found that 4 of the 5 schools with the highest number of limited English proficiency students in the area are actually in 4 different school districts, but located within a very close geographic proximity in the northern Hamilton and southern Butler County area. And from responses to other outreach activities, we also know there are pockets of uninsured children in that area. So as part of our grant, we've created a partnership with school districts in which we use various methods of identifying uninsured children in those districts, then referring the families for our service, and then paying the school district a $25 incentive for each student that gets enrolled in Medicaid as a result of our efforts. We asked one of our partner districts, Fairfield City School Districts, to host a Medicaid enrollment event at one of their schools, Central Elementary, which is one of the 4 schools with the highest number of limited English proficiency students. Our event is also Valentine's themed, a Valentine's Family Fun Day. It's targeted to Latino families, but open to all, and scheduled for Saturday, February 16th on a 4-hour period, 10:30 to 2:30 in the afternoon. The Medicaid enrollment activity is wrapped in a free, family-friendly festival featuring food, music, dancing, children's games, and health activities. The plan is that as families enter the school gym, the parents will sit at a table and talk to an application assister who will determine if their child is uninsured or otherwise interested in Medicaid coverage. If so, the application assister will complete the application with the family and gather any verification documents the family brought with them. Every family that completes an application will receive a $10 Kroger grocery gift card. Kroger matched our purchase of gift cards with a 1-for-1 donation. After the family completes the application, or while the parents are meeting with the application assister, the children can kick a soccer ball into a goal, shoot a basketball into a hoop, and get a prize. They could also do face painting, flower making, decorate a cookie. We have Henry the Hand, a 7-foot-tall hand with a smiling face will be on hand to reinforce proper hand washing techniques to avoid cold and flu transmission. Our local children's hospital will also have an activity about wearing seat belts. There'll be free food and drink, and also Zumba lessons and a salsa band and salsa lessons. We're looking to our local Covering Kids and Families Coalition to supplement project staff by volunteering to work the event. Specifically, we're relying on bilingual volunteers to help our 3 bilingual project staff in communicating with families that primarily speak Spanish. One of our Medicaid managed care plans has covered most of the out-of-pocket expenses for the event, which includes hiring the band, food, and children's prizes. To promote the Family Fun Day, approximately 7,000 students in the 4 targeted school districts will take home a bilingual flyer about the event. The Connecting Kids to Coverage team has helped us develop the promotional flyer and will be managing additional publicity to drum up attendance at the event. We're excited about the potential of the event to encourage enrollments for a number of reasons. First, Medicaid enrollment is being emphasized and incentivized in the marketing event. Marketing is being targeted to populations that we know have a high rate of being uninsured. We've designed the flow of the event so that interaction with an application assister will be incorporated as the first stop before many of the other fun activities. And as the coordinator of the event, we have some control over the event that we might not otherwise have if we were just participating in somebody else's health fair. So we'll consider the event a success if at least 50 children are enrolled in Medicaid. We think that it would take probably about 200 guests to generate that number of enrollments. So we're looking forward to a very busy day on February 16th.
That's right. Thank you, Trey. That's terrific. And thanks to all 3 of you for participating today and working so hard to plan the Winter Wave activities. We are looking forward to all of them, and I think they will all be very successful. So thanks for that. I just want to briefly describe what we have planned in the 4 other markets. In Albany, New York, we have teamed up with the New York State Department of Health and have partnered with the Boys and Girls Club of Albany to host a Hoops for Health basketball tournament on March 2nd. The outreach and enrollment event will be located at one of the main Boys and Girls Clubs in Albany. And as the basketball games go on throughout the day, parents will have the opportunity to learn more about health coverage for their children, and application assisters will be available to help them enroll on site. In Houston, Texas, we have teamed up with the Children's Defense Fund of Texas for a Valentine's Day themed Show Your Family You Care community enrollment event. We're doing this through their longstanding partnership with Fiesta Market Supermarkets. The event's going to take place on February 16th at several Fiesta store locations, and we are going to have application assisters on site, so we're looking forward to that. In Tampa, Florida, we've teamed up with the Kids Healthcare Foundation for a flu prevention and enrollment event in partnership with St. Joseph's Children's Hospital on March 2nd. This event is going to bring families together to learn more about flu prevention and enroll in health coverage with the option of receiving a flu shot. Finally, in Orlando, Florida, we have teamed up with the Healthy Start Coalition of Orange County, and we're partnering with the Boys and Girls Club of Orlando to host a Hoops for Health event day on March 16th. We're going to have an ongoing 3-on-3 basketball tournament for the kids during the day, and application assisters are going to be available on site for enrollment assistance for parents. So again, we anticipate great success with all of our Winter Wave events, and want to thank our target markets for their participation. As a reminder, the Connecting Kids to Coverage field team is here to help you. So our team is providing direct support to these 10 target markets, but we're also providing wave-specific support to organizations that are outside our target markets. The field team is organized as such into regions. Kate Krebs is working in northeast and central areas of the country. Riley Green is in the southeast, and Ashley McVale is covering the west. So if an organization contacts us for technical assistance and support, the call or email will be directed to the regional field desk representing that state, and they will get back to you. So if you're an organization from Michigan and you have a question, you will be directed to Kate, North Carolina, Riley, and Colorado, Ashley. But no matter what part of the country you're in, the regional field desks are here to help you. And just to give you an idea of what type of support we're providing, we're here to help organizations throughout the country with event planning. So if you're interested in implementing your own set of WAVE events, we can help there and provide our technical support. We can also help with information on messaging that is working best for target audiences. We can provide the template materials we've been using, tips on earned media, the PSA, and other resources that will help support outreach and encourage your local participation. And we've already heard from so many of you, and you're asking great questions. Of course, feel free to keep them coming. We're here to help. There are a couple ways to reach the field team. Of course, you can go to insurekidsnow.gov. You can also call us at 1-855-313-KIDS or shoot us an email at insurekidsnow@fleischman.com. And just one last note, additional training options are going to be available to you through these webinars. The next one is scheduled for February 19th with the focus on our allergies and asthma wave, which is the next wave starting April 1st. So again, more to come in our next webinar on February 19th. I am now going to hand it back over to Sandy.
Great. Thanks, Christine. We now wanted to open back up for questions, and we've gotten some good ones. Just scrolling through what we have here.
Here's one. This is fun going through these questions, everybody. Thank you. We did have a question from Carolyn Link. You're right. We have talked a lot about event-based outreach, and she was asking if we could comment on outreach through other means, like while a person is visiting a food shelf. This is, I think, where the really two things come into play that are important. One is the really clear, simple materials, because in a lot of these other organizations that are sharing it, they're very busy doing all of their other outreach events. But to be able to include information about health coverage is important. I don't think that, we're not suggesting that everything necessarily needs to be an event. In fact, a lot of the outreach that you all are doing and some of the most successful ones are a little bit more of that steady drumbeat, getting target audiences when you can or when they might be interacting with other services. Two things come into play. One is the compelling materials, and the second is how quickly can we connect them with somebody who can help them enroll. So being able to have a collaborative relationship with an organization that is doing enrollment where we can kind of connect them person to person can be really helpful. We see a lot of that with the school-based outreach as well, like what Trey was talking about. So you're right, absolutely. It doesn't need to be an event all the time. It can be that ongoing outreach that really does the trick.
Great. Thanks, Allison. We have some questions here, too, about the materials. The process of ordering these through insurekidsnow.gov should be available within the next several weeks. We will send information out through our listserv to let you know when they're available and online and ready for customization. And just a reminder, we are able to tailor certain elements of these materials for your state program, and that would include the income eligibility for the state, your state Medicaid and CHIP program, as well as phone numbers and URLs for contacting. So this information will all be available to you very soon, and we're opening this to partners and organizations that are doing outreach and enrollment.
Great. And Donna, we got a question here from Natasha Robinson about whether or not any of this information or materials will be directly related to the Affordable Care Act, you know, messaging toward a family versus kids and teens, or I guess I'd say adults versus kids and teens. Would you mind taking that one?
Sure. Thanks, Allison, and thanks, Natasha. So I guess there are two things to say. One is the materials are the ones that Sandy showed you earlier, and they are focused on kids, but as we, I think, know very strongly because of research and experience, one of the best strategies for enrolling children is to make sure that eligible parents are enrolled as well. And so we're going to be talking about those kinds of strategies as we go forward. So we do know that we have parents now, not in every state, but in many states, who are eligible for Medicaid but not enrolled, and we want to work on that as we work on enrolling children as well. When we get further down the road, the back to school wave, we are going to be in a point in time where we're going to be bumping up against the open enrollment period that starts October 1st and goes through the end of the year. And this is the open enrollment period for the new coverage that will be available through Medicaid in states that insurance opportunities through the exchange. And so as we get closer to that open enrollment period, we are going to be incorporating some messages that particularly are focused on pointing people in the right direction for getting more information about health insurance that might be applicable to them, but most importantly, and this piggybacks on Allison's really very complete and excellent answer to the previous question, and that is always hooking people up with some place where they can get help with that application. And we're going to have lots of new ways for people to apply. There's going to be a lot more focus on applying online. As we get further down the road, we'll be talking more about that and providing some thoughts about how to make that link for families. So great question. It's never too early to start thinking about this. We're already thinking about it, and we're planning for that back-to-school wave to incorporate some of these ideas.
Thanks, Donna. We're going to do one question here, one last question about marketing to different age groups, which we thought was a really good one.
You're looking at me, aren't you?
I am.
Yeah, that was a great question. I'm sorry we didn't get to it sooner. I do think that from a message perspective, I just have to say it since this webinar is about message, we really do not see a lot of difference in marketing to different age groups, or I will say parents to different age groups. The only age group that we're marketing to directly in some states, and I don't really mean we, us, I mean all of you, would be older teens. But in terms of tactics, I think it can make a great difference. As you all know, parents of children at many different ages are kind of often in different circles and doing different activities with their children. So if there is a specific age group that you are targeting, I would assume it's teens because just across the board that's where we see kind of the lower numbers. More often we are seeing some broader outreach there that's happening more so online, less event-based, and very often through schools. I think that has probably been the #1 most successful outreach across all kids, frankly, but definitely teens, is to really engage with schools. And if you're able to do that in your school district, I think that would be a great start.
Great. Thanks, Allison. A lot of great questions from all of you. Thanks so much for sharing. The ones that are very specific, we are going to respond to you via email. You've asked some really good ones, and we just want to make sure that we are directly addressing your questions. So we can respond to you via email. And as we said earlier, we have contact information for our Connecting Kids to Coverage communications team. We are available whenever you need us at the hotline, which is 1-855-313-KIDS. And we are open to responding, checking your materials, helping you with your messaging, anything that we've learned today that we can help you apply to your outreach and enrollment efforts. We are happy to provide that assistance to you, so please don't hesitate to get in touch with us. I'm going to turn it back over to Donna now just for some closing remarks.
Great. Thank you, Sandy, and thanks to everyone, both our presenters and also all of our participants. I know that we had over 200 participants on the webinar today, and we all know that means some of you are huddled around the computer terminal in your office. So when we see 200, we know it's lots more people than that, and we're really grateful for that participation. So thank you so much for joining. I have a couple of announcements that I wanted to make before we say goodbye for today. First is a reminder to reach out to your field contact if you have a question. You had that great map with names and connected to regional field folks from, oh, here it is again, from Christine. And I really urge you to get to know that person, because they are a really fine team, and when they get to know you and you get to know them, you'll be getting the kind of tailored assistance that you need. And they have great ideas and great energy, and we hope that you all take advantage of that opportunity. Earlier, we heard that the next The next webinar is already being planned, so I wanted to repeat that our next webinar, which is going to focus on our allergies and asthma wave and also talk about partnerships, is scheduled right now for February 19th, and we'll be sending out more information through our listserv. We will also be having a broader set of webinars on some very specific topics. As we solidify that schedule, we'll send that out to you through the listserv as well, so that you can start holding that time on your calendar when you see a topic that is of particular interest to you. But we are it's looking like we'll have something at least once a month, maybe even a little bit more often. So we're very, very pleased about that, and we know that there's a lot of interest and enthusiasm for learning, but also for hearing from peers, and that's why I wanted to especially thank our partners from Atlanta and Cincinnati for their great presentations today. You can tell that there's going to be some fine things going on around Valentine's Day in those areas, and then also in the other target markets that we heard about. We're very excited about it. Wish I had a plane ticket, but I don't. I wanted to make one last announcement before we close up for today. I am suspecting that most of you on the webinar today know about this, but in case you don't, I wanted to make sure that people knew that the solicitation for the third round of Connecting Kids to Coverage Outreach and Enrollment Grants is now available. It's been available now for a couple of weeks. It is a funding opportunity through CMS. It will be a total of $32 million in outreach and enrollment grants that is available to a wide range of applicants, whether it's state and local governments, nonprofit organizations, providers, school districts, much the same as we've made available in the past. If you haven't seen the solicitation, you can go on to insurekidsnow.gov. In the spotlight box up in the right-hand corner of the homepage, you'll see a link to the funding opportunity. When you click on it, it will tell you more about the funding opportunity and what our areas of focus are this time, and it will also bring you to the solicitation itself, the application itself. So if you haven't seen it, I urge you to go check it out. And I want to also let everyone know that we have a deadline for submitting proposals of February 21st. So it's not a lot of time, but I think there still is time if you haven't started the process of preparing what we know are going to be some really great applications. We're eager for them. The more we have and the better they are, it's a challenge for us, but we know at the end we will have some great projects going on around the country which will help get eligible children enrolled. So we're very, very excited about that. When you go onto that website, if you have questions about the solicitation itself, it'll tell you about a conference call that we're going to have the beginning of February, and it also has a special email box for you to send questions. So it's separate from the questions that you might be submitting about outreach and enrollment. I just wanted to make that clear. It's a special box just related to the funding opportunity. Anyway, I'm glad to have the opportunity to let you know about the resources that we have available, to urge you to apply, to urge you to take advantage of the opportunity to have those materials that you saw today tailored so that they best meet your needs, and we look forward to having you and your colleagues from around the country on our next webinar, again scheduled for February the 19th. So I want to thank everyone again for joining us. I want to thank the team for some excellent presentations, and I think we'll say goodbye. Thank you, everyone.